In this video, I'll be reacting to Beauty Trends Are Getting Out of Hand by Coov's Studio. Took us a while to figure out how to pronounce their name.
Okay, so have you heard of the Megan Fox bottom teeth trend?
I have not.
Me neither, but the story goes that actress Megan Fox has made it trendy to talk with your bottom teeth showing. As a result of this, dentists are seeing an uptick in Invisalign for the lower set of teeth, which goes to show two things. A, celebrities hold a lot of power in influencing beauty standards.
We know that for sure.
A dentist defines an aesthetic smile in a few ways. The position of your frontal incisors in relation to your face, because you wouldn't want Tom Cruise-like center teeth. The pull of the lip curtain, you wouldn't want a gummy smile. The proclination of the upper teeth, because you wouldn't want buck teeth, and so many more things.
And the lip, as we know, influences that quite a bit, the way that the teeth are positioned. So sometimes I'm doing lip lifts to help reveal more of the upper teeth, and sometimes people actually need lip reductions to help reveal their upper or lower teeth. My guess is one of the reasons why the lower teeth trend might be happening is because I think as people get more and more filler into their lips, especially into their upper lip, it's actually covering up the upper teeth, and so now you're seeing more of someone's lower teeth. So I'm not sure if the whole Megan Fox thing that he's talking about is something that she intended to do, or it might just be an unintended consequence of getting lip filler.
To expose the lower set of teeth, either the tongue has to be placed further up on the hard palate right behind the teeth. You can try it yourself by making a T sound and see how your lower teeth sticks out more and the upper set is hidden. There is another reason why you talk with your bottom teeth as opposed to both, like most people, and that's injectables.
Yes.
TikTok illustrates it best.
The upper lip we talked about, right, with the filler coming down onto the teeth and covering them up. But the other thing is, as you get injectables into the bottom lip, you can actually get a protrusion of that bottom lip and almost like an eversion that also exposes the lower teeth. And also, as you fill, there's almost like an expansion of the tissue, and sometimes I find even maybe just a weakening of the muscle, which can also be related to just the aging process. So there's this more eversion to that lower lip, and that also increases the bottom tooth show.
The volume of the lips makes movement difficult and exaggerated. Pair that with Botox, which has a relaxant effect on the muscles, and your lip is going to be virtually immobile. Now think to yourself, where do most people get lip injectables? Do they get it on the upper lip, which is actually thinner, or the lower lip that is more plump?
Well, they tend to get it into both, I would say. Because most people, they come in for lip filler and you have a syringe, right? And most people get upset if you only inject a portion of that syringe because they feel like they've paid for that full cc of volume, right? It's hard to take 1 cc and just put it into the upper lip, right, with a single treatment. So usually there is a distribution of this filler into the upper lip and into the bottom lip with a single treatment.
A theory, and this is purely speculation, is that Megan Fox now talks with her bottom lip as a result of injectables. The hypomobility, in other words, the lack of mobility of her upper lip, is not natural and hasn't actually always been the case. In a 2009 interview with Jimmy Kimmel, before her Kardashification era, she had relatively thinner lips and spoke with adequate lip mobility, exposing both sets of teeth. On platforms like TikTok, creators are making fun of the trend by exaggerating the movements, and in reality, it shouldn't be something you should train yourself to talk like, especially not because Megan Fox does it, which again, speculation, might be because of other reasons.
Yeah, and it's actually an unintended consequence of trying to have nicer lips. And that interplay between the lips and how they look and the amount of tooth show is very important and something that's highly relevant to the smile.
During this trend, that people are realizing the unshapely fact of their lower teeth, that most people don't have aesthetic lower teeth, and getting Invisalign to correct a mostly unimportant beauty standard, to talk like Megan Fox. You're better off realigning and retraining your lips, perhaps with a speech therapist, to a more natural position, exposing 60 to...
Well, there's nothing wrong with getting Invisalign for both, sets of teeth, upper and lower, but it's silly to get Invisalign on your bottom set of teeth only because clearly, it would be great to have just a full, complete set of nice looking teeth. So yeah, I'm not sure if they're only getting it on the lower teeth or on both, but yeah, I mean, it does seem like a silly trend to me.
But that's it for this video. It is overall a pretty silly beauty trend, and it's going to stay just that, a trend.
Well, that was interesting. I thought there were going to be multiple trends covered, but it looks like there was just coverage for this one trend. Most of my patients, I would say, are not asking for this. The other thing that's interesting after a lip lift is as the upper lip moves up and exposes some of the upper teeth, usually the brain adapts and the lower lip will actually also come up to a degree. As that happens, the lower teeth tend to be more covered because of the bottom lip coming up and covering it in part. So most patients appreciate that secondary effect of a lip lift. What's happening here is the result of more lip filler being used. And that's actually why many people, as they realize that lip lifts exist, they start to look into that instead of filler, which has some of these unintended results. That is my impression of this, and hopefully you guys enjoyed the reaction. Make sure to subscribe to the channel, turn on all notifications, and make sure to check out our video on Megan Fox's possible plastic surgeries.